Betadine Antiseptic Ointment. Povidone iodine water-soluble antiseptic ointment, for external use only. Bacteria, viruses, fungi. Healthy healing starts with Betadine Antiseptic Ointment. Instruction for use: Betadine Antiseptic Ointment. Non-greasy, washable active substance, Povidone iodine PVPI, broad-spectrum microbicide, for use on the skin and wounds. Composition: Povidone iodine 10%. Indication: Betadine Antiseptic Ointment is a topical antiseptic and for protection from infection for burns, scalds, blister, cuts, scratches and grazes. Contraindications: not to be used in known or suspected hypersensitivity to iodine or povidone or any other of the excipients. Not to be used in hyperfunction of the thyroid, hyperthyroidism, other manifest thyroid diseases, as well as before and after radioiodine therapy for hyperthyroidism, until a lasting cure has been obtained. It should not be used for 4 weeks prior to radioiodine scintigraphy or radioiodine treatment, or thyroid carcinoma. Patients with goiter, thyroid nodules, or other thyroid diseases, especially elderly patients, are at risk of developing thyroid hyperfunction hyperthyroidism from the administration of large amounts of iodine. Not to be used for children under 2 years of age. Not to be used on patients on concurrent lithium therapy. During pregnancy and lactation, Betadine Antiseptic Ointment should only be used if strictly prescribed by the doctor, and its use should be kept to the absolute minimum, as absorbed iodine can cross the placental barrier and can be secreted in breast milk. This also applies to newborns and infants up to age of 2 years. Povidone iodine use may induce transient hypothyroidism in fetus or in the newborn. Povidone iodine should be avoided in such situations. In these cases, a check of the child's thyroid function is necessary, especially in areas known for endemic low dietary iodine and tendency to goiter. Also, any possible ingestion of the ointment by the infant must be absolutely avoided. Side effects: Povidone iodine may produce local skin reactions, although it is less irritant than iodine. The application of povidone iodine to large wounds or severe burns may produce systemic adverse effects such as metabolic acidosis, hypernatremia, and impairment of renal function. Interactions with other drugs. The concomitant use of wound treatment products containing a so-called enzymatic component such as hydrogen peroxide, silver, and taurolidine leads to a weakening of the effects of both substances. The use of mercury-containing wound treatment products at the same time or shortly after Betadine Antiseptic Ointment can, under certain circumstances, lead to the formation of a substance from iodine and mercury, which can damage the skin. Note: due to the oxidative effect of Betadine Antiseptic Ointment, various diagnostic agents can show false positive results, e.g. tests with toluidine or gum guaiac for the determination of hemoglobin or glucose in the stool or the urine. Use of Betadine Antiseptic Ointment may interfere with various tests: thyroid scintigraphy, determination of PBI protein-bound iodine, radioiodine diagnostics, or thyroid function, and can make a planned treatment of the thyroid with iodine. Radioiodine therapy, impossible. After the end of the treatment, an interval of at least 1-2 weeks should be allowed before a new scintigram is carried out. Dosage instruction and mode of application: the ointment can be applied once or twice daily for maximum of 14 days. Spread the Betadine Antiseptic Ointment evenly over the area of damaged skin. If necessary, a dressing can be applied. The affected skin should be cleaned and dried. Discontinue usage in case of allergy. If there is no improvement of the symptoms after several days, 2-5 days, regular application of the ointment, you should consult your doctor. Storage precautions: store temperature at or below 25. Other instructions: not to be used after the expiry date. See data printed on the packing. Keep medicines out of the reach of children. Click subscribe to Users Productions YouTube channel.